Hey everyone, Evan Kirstel here with VMware. Michael Robinson, VP of Healthcare at North America for VMware. Michael, how are you?
I'm good, Evan. Super excited to be here. Thank you for
Well,
having
it's
me.
Friday. We made it, and we also survived HIMSS, the biggest healthcare event in North America, perhaps in the world. And it was quite an event. Maybe introduce yourself and your role at VMware before we dive into some of the themes from HIMSS.
Yeah, thank you, Evan. And again, my name is Michael Robinson. I manage the healthcare vertical within VMware. I've been here 6 years. Actually, joined VMware to build and help drive this vertical for VMware. We believe that the technology portfolio that we take to market is very much aligned with the goals of healthcare in terms of reducing costs and improving outcomes. And so it's a little bit of a passion for me in terms of the intersection between technology and healthcare, and we feel like we can help move the dial.
Move the dial indeed. And I really enjoyed your session, your panel with real practitioners, CIOs, trying to manage this transformation. There were so many themes at HIMSS, and indeed, you do so much in healthcare. What was top of mind for you at HIMSS, and what were some of the key points of discussion in your various sessions?
Yeah, so I spend about 80% of my time on the road, Evan, and talking with customers and partners. And there are a few recurring themes in healthcare today that I think are unavoidable. One is, managing cost and bending the cost curve within healthcare. Obviously, technology has to also be able to improve outcomes. So from a patient experience perspective, clinician experience, how do we do that? And then security is always top of mind. And so for as we all know, healthcare is a huge target from a ransomware perspective. So definitely a top of mind discussion. And then one that you might not think is a technology issue, but really around staffing.
Hmm.
And availability of staffing is again a common theme that we hear from most of our customers in terms of a challenge currently in healthcare.
Yeah, so many challenges. Of course, everyone knows of VMware in our space as techies, but the healthcare IT mission at VMware is really interesting. What's your main goal there? I mean, what's your mission within the healthcare group at VMware?
Yeah, so our main mission is to make sure that we are a relevant player in terms of providing thought leadership around how technology can address those issues that I just articulated. And again, I share this all the time. We spend a significant portion of our GDP on healthcare and don't necessarily get better outcomes. And so, as we believe that technology can really help change that dynamic in a good way in terms of how do we improve outcomes and also make sure that we are providing care at point of care service for patients.
Yeah, it's all about patients, and we care so much within this community, this healthcare community, about patient outcomes. Where are we in our digital transformation journey in healthcare? Are we halfway there? Are we part of the way there? I mean, how do we lay that digital
Yeah,
foundation?
so I've been in the healthcare vertical for about a decade and a half now. I've been in the industry for almost 40, but this has become a passion for me. I managed the health and life sciences business for
Mhm.
a Fortune 10 software company prior to coming to VMware. And what I've seen over the last 5 or 6 years is an exponential growth in terms of both technology adoption and improvement in terms of outcome. And I think cloud has a lot to do with that. I'm sure we'll talk a little bit about our vision for cloud. But I see where 5, 6, 7 years ago, it was almost a cloud avoidance kind of strategy in most health systems. And now it's, how fast can I get to the cloud? What's the smartest way for me to be able to do that? And how do I, tie that again to providing better outcomes for our patients?
Yeah, so important. Now, multi-cloud is always a big topic, but it was particularly relevant at HIMSS. You know, give us the lay of the land. What are you seeing out there with multiple clouds and hybrid cloud and public versus private. I mean, it's a very complex landscape these days.
It is very complex, Evan, and a couple things that we're seeing. First of all, there have been multiple studies across the board that say most industries, not just healthcare, have a multi-cloud strategy, whether they realize it or not. And so, how you manage that environment, as you mentioned, is very complex. And do you have a holistic, kind of codified strategy to address that is very important. And that's where we believe that VMware plays a critical role in terms of helping organizations move from what we call cloud chaos into cloud smart. And so that's making sure, it's application centric, it's workload centric. It's making sure that you have the right environment for the right workload. So whether it's private cloud on-prem, whether it's, in a colo environment, or it's on a hyperscaler, that you have the right environment for the workloads that you're running and driving the outcome. So for example, the hyperscalers all offer varying microservices on the back end that a health system might want to take advantage from an AI or an ML perspective. And so our infrastructure, again, building on our legacy of virtualization, allows us to give organizations the business agility to be able to move workloads back and forth, depending on where the best location for those workloads are, and also to take advantage of either the economics of a particular environment or maybe the microservices that are provided by that provider as well.
Yeah, that's so valuable. So one of the annual themes at HIMSS is interoperability and all the
Yes.
challenges. And that kind of is your sweet spot at VMware, I believe. You're like the Switzerland of integration.
I love that.
How
I
can we
love that
get
term, and it's starting to resonate. It's starting to resonate in the marketplace because, again, we are that intermediary that allows organizations to choose the best fit for their workloads. And again, interoperability. When you think about that, at the heart of that is really the democratization of data
Hmm.
and making sure that you can get data at the point you need it. And candidly, data has been kind of locked away in health systems, but it's been growing exponentially. So you have that dichotomy of A, it's been hard to get, and B, now it's growing exponentially. How do I deal with that? And so we believe there are strategies, and it's one of the things that I'm not sure everyone is aware of in terms of VMware's capabilities around the ability to build, run, and manage workloads. And so our Tanzu platform allows us to work with developers to kind of democratize or to work at democratizing that data. So you don't necessarily have to, refactor all of those applications into the cloud. There are ways that you can extract data and then be able to utilize that in providing clinical outcomes that in a much smarter way.
I love it. Smarter cloud, smarter ways of doing business. And it's not just data, right? It's the interconnected devices
Correct.
and the
At the
Internet
edge,
of
right?
medical things. I was
Correct.
actually talking to someone the other day who's developing smart insoles. So these are Wi-Fi and 4G insoles that for telehealth and remote patient monitoring and
I think I need those,
uh,
Evan.
and I was like, man, there's just so much data being connected to the network these days. And, how do you secure it and provide access in a reliable fashion? And speaking of security, I mean, that's also a big mission at VMware. What are some of the security challenges? Obviously, we see the ransomware issues every day within the hospitals. But what other security issues are kind of come to the fore?
Yeah, you mentioned the proliferation of devices and devices at the edge. So again, being able to manage those devices in a secure manner is absolutely critical. But one of the things I tell clients is that we're probably the sixth or seventh largest software company in the world, independently. When you look at our security portfolio. And we're probably one of the only security software companies that can both, secure the edge, also monitor east-west traffic, and then also provide remediation services in the case of a ransomware attack. And so the
Wow.
depth and breadth of our portfolio, I think, is one of the things that differentiate us in the marketplace. And obviously, in healthcare, with the protection of personal health data, et cetera, it's really critical that health systems have a strong security posture.
Yeah, well, that's really this renewed focus on security. Hopefully, will begin to pay dividends, and we'll see less, of this moving forward. Um, and you collaborate with lots of different players in the ecosystem. Whether it's the healthcare IT leadership themselves, the application providers, the cloud providers, the storage, the servers. Tell us about that collaboration in healthcare IT and how it's pretty important to bring all these pieces together in a coherent way.
Yeah, absolutely. So, you mentioned the EMR vendors, the other ISVs, both large and small. It's important that we understand how they are developing in their strategies for the market as well. In many cases, their infrastructure is built on our technology as well.
Mm.
So, it's important that we stay current in terms of what their aspirations are and where they go. We already talked about the hyperscalers and our collaboration in terms of, making sure that you can run VMware or virtualized workloads in their environment. So, really strong collaboration, both on the go-to-market side, but also on the engineering side of the world as well. So, close connections in terms of how we work with those those organizations, and then obviously, the integrators as well, in terms of, as they
Mm.
execute their cloud strategy, as health systems execute their cloud strategy, a lot of times they're being influenced by some of the global integrators. And so we collaborate with them as well.
That's fantastic. What are you looking forward to over the next few weeks and months? I mean, HIMSS was a pretty all-consuming event. Any other
Yeah, it
events,
was back.
sessions, or
Yeah, it was
yeah?
back, Evan. So, very well attended. We saw some really good sessions. The focus on, as you mentioned, interoperability and data is exciting for us. The digital side of the business, in terms of, how we improve the experience for clinicians and patients is important to us. And so, when I talked about all of the challenges in healthcare, we feel like we fit in and have solution sets
Mhm.
that address all of those. Obviously, we can't do that alone. A lot of that is in collaboration with our partners and our customers. But, we feel very confident that where the challenges are in healthcare, we very strongly align in terms of how we build, run, manage, move workloads within the cloud environment. So very
Yeah,
excited about the level of adoption of our technology in healthcare.
I love that. And we're technologists, but you also, I sense the sense of urgency and focus on healthcare. How did you get into the healthcare space? What was attractive or interesting to you to
Yeah, no,
get on this mission?
that's a great question, Evan. And as I mentioned before, I worked for a large software company, and I actually managed their business in the Middle East and Africa.
Mm.
And so the public sector business. So in the Middle East and Africa, the public sector businesses include education, healthcare, government, financial services, oil companies, you name it. But the two verticals that really resonated for me during that time, and this is about 15 years ago, were education and healthcare. And
Mhm.
I also got to see the dichotomy of um, services in healthcare from, say, sub-Saharan Africa to,
Mm.
the Emirates, where Cleveland Clinic built a facility in Abu Dhabi, and it was state of the art. And and then you go to Dakar, Senegal, and it's very rural and remote, and no access. And so that's where I started to really develop my passion. And I came back, as I mentioned, I was with Microsoft, and I managed the health and life science business
Mm.
for Microsoft for 5 years. And again, just continue to build that passion, believing that technology is the key enabler to driving better outcomes. And I retired from Microsoft, and then a friend approached me about helping build a vertical here at VMware. And so, the old saying from The Godfather, they let me out, but then they sucked me back. So I just came back, and I love what I do. I love the depth and breadth of VMware's portfolio and how it aligns to the needs of healthcare. So we're excited, and we're having fun.
I sense that, and your colleagues are all on a mission like yourself, which is
Yeah.
so
That's
fun
what I
to
love about
watch.
healthcare, Evan. It's mission driven, and the organizations we work with are mission driven as well. So
Yeah,
that's the fun
so
part of it.
important.
Yeah.
Do you have any trips personally, professionally coming up that are
Yeah,
worth
so my
mentioning?
wife and I travel pretty extensively. As I mentioned, I lived abroad and traveled. I've been to over 100 countries, but we have a couple of trips coming up. We're going to be in Europe over the summer. We do an annual trip, which we resume post the
Yeah,
pandemic,
yeah.
to the Netherlands and Copenhagen. We'll do this summer. We're going to do safari in Kenya in
Oh
September.
my gosh, a
And,
bucket list item there. That is
yeah,
exciting.
yeah. So we've done a few, but we love to do that. And then finally, it's 2024. We're going to spend some time in South Africa. We're going to do a cruise to Namibia in South Africa. So super excited.
Man, I hope you're posting somewhere, maybe on Facebook
You
or
know,
Instagram, because I want to live vicariously through
yeah,
you.
my wife does. I let her be our social steward of all of our trips.
Well, it's so exciting for the update, and congrats on the mission at VMware. And
Evan,
everyone, thanks for
yeah, I want to
watching.
thank you for what you do as well, because
No, yeah, my
it is
pleasure.
important that we share this information, and look forward to working with you. So I want to thank you as well.
Oh, thanks so much, everyone. Thanks for joining. Have a great Friday. Have a great weekend.
Thank you.
Stay
You too.
safe.